Okay, I wanna highlight a new sealer that just came out a couple months ago. It's called ProRoot Endodontic Sealer from Dentsply Tulsa. It comes in a box. It has 12 of these packets. This is a single dose packet, so you use this packet and this ampule for one tooth. Okay, and in just a minute I'll go ahead and I'll show you how you mix it. You know, it's pretty simple, but I'll still kind of show you what I do. The ProRoot is a pretty exciting sealer. It's a calcium silicate sealer. It's an MTA based sealer. It's got a lot of advantages. It's osteoinductive for cementum regeneration. It's hydrophilic. It'll set in moisture. It's it has a high pH, so it's antibacterial. It is very biocompatible with the periradicular tissues. Does not promote an inflammatory response. You will get the best post-operative. You have the least amount of post-operative pain when you use this sealer, this ProRoot sealer. Calcium silicate sealers are so gentle and kind to the periapical tissues, and my patients love it, and they just don't have as much pain as I used to have when I used different sealers, and that's a huge bonus for me. It's retreatable. It's an opaque sealer. It is retreatable. Okay, even though it's MTA based, you can retreat it as long as you use a cone. It is a sealer that has it flows. It has good flowability and very good coatability too. Okay, so it'll flow into the anatomy, that alternative anatomy in the canal system, and it'll coat the walls extremely well. And this ProRoot is you can use this in a single cone format. In other words, you can take a cone and you can butter it, place it into the canal, and you could use this sealer as not only a sealer but also a filler, as long as you're using a gutta-percha cone. It has about a 60-minute working time, and that's pretty fast, which is nice. It's got about a 60 to 65-minute working time. And so let's show you how to mix it. What we do is you open the packet, and you take all of it out. Liz here is my assistant. She's going to help. So it's a single unit, a single dose packet. Okay. And you just kind of get it out. We tried saving half a packet, and then it just doesn't work as well. You just kind of, and then you do the full ampule of liquid, and you really got to kind of push on it. Okay. Got it? Okay, and you just sort of mix it in. Liz does it really slow, but I'm going to go really fast just because we're filming, so don't do this at home. But I'm just going to get this going so we can kind of show the properties. You're going to be a little more careful than this. You can mix it on a glass slab or a regular pad too. Okay, so you want to get everything in, and then okay, so you can see there's definitely plenty of sealer to be. You're not going to be short on sealer, which is a good thing there. So what I do is I'm using this Wave-One Gold cone. If you're going to use a single cone technique, what you'd want to do is you want to butter this cone, and you butter it. Then I'm going to place it down to working length in my dry canal. Of course, you're going to use paper points, do all your stuff. I'm going to place this down to working length. Then I'm going to take it out. Okay. Then I'm going to rebutter, and then I'm going to place this slowly back into working length. I call this the double butter technique, and that's how you can do a single cone hydraulic condensation. You can get a lot of sealer and the cone in there, and it'll get a nice dense fill. You can also do a warm vertical compaction, and a lot of times, like on a bigger canal, a palatal canal of an upper molar or a distal canal of a lower molar, I will do a warm vertical on that canal, because what happens is if you just do a single cone, oftentimes you'll see a big void, kind of in the apical third on the lateral wall, and so you'll see a big void with the single cones. And so sometimes what I'll do, I know that I can see how big the canal is, so I will do a kind of a warm vertical, but you don't have to, because oftentimes this sealer will seal that apical third, that red zone, just because there's a void. It doesn't look as sexy, your root canal, and that's why I always want my root canals to look sexy. Okay, so that's the ProRoot sealer, and it's a pretty exciting sealer. It's new, and I'm looking forward to using it more and seeing it in my practice. Thank you.